Okay, disclosures, I've been involved with multiple laser companies in multiple capacities over the years. Just a brief history of facial skin rejuvenation. We started with the CO2 resurfacing lasers, moved on because of all the complications with those to non-ablative, then we moved to non-ablative fractional, and now we're talking about ablative fractional. When you look at the literature on fractional lasers, you need to differentiate whether it is a non-ablative fractional you're reading about or ablative fractional, because they're very different devices, very different effects. Okay, fractional laser resurfacing indications, you can use them for many, many conditions. We're going to discuss that in some detail. Okay, the question comes up that when you're out in the marketplace, how do you decide which fractional laser to get? There are multiple parameters you have to look at when you look at a fractional laser. I think user-friendly is a very important one. I think cost is a very important one. I think the ability to adjust the laser is a very important one. All different adjustments. It really alters how you would use the laser. And we did one study on one comparative fractional laser study. Actually, Dr. Dover did that one. And if you look, he compared 4 fractional devices using specific settings. So note in this study is when he did it, there were certain settings he used on each device. Different settings might have yielded different results. But in his study, what he found was all devices had equivalent efficacy for selected procedures. And he said he was going to publish it with a follow-up, but in fact, that study, the follow-up, has never been published. Okay, so carbon dioxide laser resurfacing was first published in 1993. That's right, first performed 1993. Some of us were actually doing CO2 resurfacing a little bit before then, but it was more primitive CO2 lasers. Beyond that, the goal was to quickly heat the tissue, instantly vaporize it, and thereby resurface the tissue, not to slow heat it. And there were significant complications reported initially. So in 1995, I came out at a meeting. I reported we should start using what I call the 1995 method. And it was a different way of doing resurfacing to avoid and minimize the complications. Also, I edited a book in 1998, Laser Skin Rejuvenation, the thrust of which was to explain to physicians how to avoid complications and problems and get good results with CO2 resurfacing. Okay, CO2 resurfacing is the optimal procedure. You get the best results. Skin contracture, skin looks better, tighter, scars are better, pigments better. Problem is long recoveries. We moved on to fractional resurfacing. And they moved on finally to the ablative ones. We discussed that. Okay, so then what you have to look at is what your goals are for fractionated laser resurfacing. What do you and your patients really want to achieve? So what you want to do is you want to get similar histochemical effects to CO2 resurfacing. We're going to hit this again. This is a very important concept, the histochemical effects of lasers. When you look at what a laser does, don't think about what it does to only the surface. Think about the histochemical effect. You want to reduce rhytids, smooth the surface, get the skin to contract, very important to the patients. And you want to remove enough epidermal pathology so the patient has an overall noticeable improvement. And for that reason, in some patients, we have to add erbium resurfacing. Okay, so what you have to then look at is what are the histochemical effects of CO2 resurfacing. So these papers were on the original resurfacing lasers, not the fractional CO2 lasers. Okay, and basically if you look at it, you get cytokine induction, metalloproteinase is produced, and with that you get a histochemical effect in resurfacing that improves the skin. Okay, so then you start looking at laser combination procedures and you go back and you say, the goal of doing that is to get a greater result than with the fractionated lasers alone. And we're going to come back, by the way, histochemical results in a minute. And what you do is you can use your fractionated CO2 laser with varying fluences, and pulse duration is a very important concept. If you cut your pulse duration on a CO2 fractionated laser, it becomes more and more superficial. It is less pulse duration, it penetrates less deeply. That and the fluence are the two things that control your depth. So you can control depth with that on a fractionated CO2 if you want to get superficial epidermal disease. But you can also add a superficial erbium resurfacing to the fractionated CO2 resurfacing. Okay, so when you combine them, what happens is, first of all, many patients will benefit from just fractional CO2 resurfacing without the erbium, but there are selected patients who have a lot of lentigines, a lot of dyschromia, who need more than that to get the optimal result, and those are the ones who need the addition of an erbium resurfacing laser. Okay, so the way I do this, and it's very important to allow time to perform this correctly, which is, first I do a fractional procedure on one side of the face, Then I go to the second side, which allows the first side to have the dermis cool down so you have less dermal bulk heating. Then I go back to the first side, and that's when I do the erbium resurfacing on the first side. By the time I get to the second side for the erbium resurfacing, it is had time to cool from the dermal bulk heating, and then I do an erbium resurfacing on the second side. Just a patient who had this done, and you can see they have a relatively quick recovery and nice improvement in the skin surface as well as in the overall skin improvement at 14 days. Oh, hold on, we skipped that one. Okay, this is a very interesting case that another physician performed, and she decided she was really going to hit those rhytids deeply, did a fractionated CO2 and a superficial erbium resurfacing, dramatic improvement in the upper lip rhytids, did have a small amount of hypopigmentation, yet her patient really liked this and actually liked the hypopigmented areas better. Okay, so the question comes up then, as we discussed a minute ago, does fractional CO2 resurfacing have the same effect as CO2 resurfacing at the histochemical level? Because that's really going to determine what you see in that skin 3 months later, 6 months later, a year later. And so the same group that did the study in '04 went back and did a study in 2010. And on the fractional resurfacing, they did the same molecular analysis and found they had the same sort of results histochemically as carbon dioxide laser resurfacing. A critical point. So when you're doing this, don't only think about what you're doing to the skin, think of the histochemical benefit, because that's what's going to make the big difference. Okay, so we look at it again. You get collagen denaturation, contraction, neocollagenesis, genesis, we know that. Okay, so let's go on. At the molecular level, once again, you get the cytokine induction, metalloproteinases, and therefore you rejuvenate the skin at the histochemical levels. You're causing real changes. Now, the next thing that comes up, and this is a critical thing, Dr. Heffelfinger just alluded to it, but do you get facial skin tightening? Because in my office, that's the holy grail. Not only do they want their skin to look better, they want that skin to be tighter. And don't doubt that for a minute. So if you can get that skin a little bit tighter, and you get their skin looking better, you have just hit the ball out of the park. Okay, so the question is, do we get this, and when do we get a more permanent effect? And the only way you know is by comparing before and after photos, but it sort of sneaks up onto you after fractional CO2 resurfacing. In other words, you look at 2 or 3 months, you know, the skin looks a little better, but you don't really notice. Then you start looking at photos a year later, 2 years later, and you go, oh my gosh, they do look a lot better. So let's go to that. Okay, if you look at this woman, here she is before fractional CO2 laser resurfacing. She had this before one. So she has laxity along her jawline, not as defined. Her cheek is looser. Everything is just not as tight and as snug looking. So here's the same lady a year later. Look at that jawline, look at her cheek, look at her skin. That makes a big difference. You have truly rejuvenated her face, and she has not had any incisions.
How many treatments was it?
One.
Just one.
So that first one was after 1 treatment. Now this is a lady 2 years later, but this lady did have 2 treatments over 2 years. So let's take a look at her. She had fractional CO2 resurfacing twice. So just to go over this again, she's 2 years older in this photo than she is in that photo. Okay, so let's see what she looks like. Her cheek is tighter, her jawline is more defined, her submental skin's a little bit tightened up, her skin itself looks better. Okay, you have just hit the ball out of the park, and that is one happy patient. Okay, so let's talk about fractional CO2 resurfacing in summary. 1, it's efficacious. 2, if they have superficial epidermal pathology, such as lentiginous dyschromia, you can use erbium resurfacing to it. You get some increased risk when you combine 2 lasers. You have to be aware of that, such as the hypopigmentation you saw in 1 patient, but it's not a major problem. You can achieve persistent facial skin tightening 1 year later, 2 years later. They're tighter, they look better than they did the year before. And the skin tightening occurs gradually, so it sneaks up on you. So if you only see that patient at 3 months, you won't really notice it. You have to get careful photos to really see it. Thank you.
So that was contrary to what I said.